Looks like this the whole time. Big breath. Hyperventilate. Let's go.
So what is professionalism in EMS? Professionalism is based on meaningful interactions and lead to a more respected field. Professionalism is based on the nature of the work, essentially nuances and connotations of the work that you're doing, which is, in this case, EMS. Professionalism applies to both patients and social expectations, including family, the general public, the doctors that we interact with, nurses, social workers, what have you. Dr. Herbert Swick from the University of Missouri states, "Professions serve as guardians of social values, and professionals are expected to articulate and hold these values publicly. A profession then becomes a way of life with a moral view." Professionalism isn't just based on appearances, which is a well-pressed uniform, a badge, proper colored pants, boots. It's also based on introductions, including the proper nomenclature of the person that you're talking to, the patient's family, the doctors. It's also based on establishing collegiate interactions. Schwick outlines 9 different types of things to describe professionalism. And he states, "We are worthy of the trust bestowed upon us by our patients and the public, because we are working for the patients and public's good. Failure to demonstrate that we deserve that trust will result in the loss, and hence lost in medicine's status as a profession." Firstly, the patient's interests are above your own. You are the patient's advocate. On every call, you put the person's interests above your own. Whether it be a 6 o'clock in the morning call, you're very tired, it doesn't matter. That person's interest is above your own. Professionalism establishes a quality of care. Secondly, professionalism is based on high ethical and moral standards. Patients have a right to expect us to uphold a duty and to do right and to avoid wrong. Professionalism is also based on a duty to uphold a social contract. The Medical School Objectives Project, which is used for doctors when they attempt to take the exam to become a doctor, states that a commitment to provide care to patients who are unable to pay and to be advocates for success for healthcare for members of underserved populations. That is to say that we get tapped out on calls such as to places like Glenbrook. It doesn't matter if those patients can't pay. It's not our job to worry about that. It's to be a professional to the patients and worry about their interests, regardless of their social and economic status, race, gender, what have you. Fourthly, professionalism is based on core humanistic values. Humanistic values are a practice of human endeavor. Professionalism is based on being able to be humanistic to your patients, to treat them like you would treat anybody else. Professionalism, especially in EMS, requires honesty and integrity, caring and compassion, altruism and empathy, respect and trustworthiness. Professionalism is also based on accountability. We have to set a higher standard of care for our patients. Meaningful peer evaluations between yourself and your partners, your bosses, those around you, is the first mechanism to enforce standards of practice and exercise accountability. That is to say that after a call, it is best to talk to each other, figure out what you did wrong and how to better yourself, even if you didn't do anything wrong. 6, reflection and a commitment to excellence. Professionalism is based on being able to reflect and establish a commitment to improving the things that you need to improve on. And this is to improve the quality of care for your patients. The ability to reason deductively in solving clinical problems is essential. 7th, you have a commitment to scholarship. As a professional, you have a commitment to better yourself in every way, to look toward a higher knowledge and gather your knowledge base better for your patients. So in conclusion, in adherence of professional values and behaviors, practicing professionalism can help maintain the distinction between medicine as a profession and medicine as a commodity. You have a dedication to your patient's interests above your own, to establish a high ethical and moral standard, to uphold social contracts, to establish a core humanistic value, to keep accountability for yourself and those around you, to dedicate yourself to reflection, to have a commitment to excellence every day, and to have a commitment to scholarship to extend your knowledge. Does anyone have any questions?